Okay, this is Stephanie Lindsey with Maryville University performing my health assessment on Deborah L. Deborah emptied her bladder before the assessment and was placed into a gown for modesty. Her height and weight was checked via standing platform scale. The weight is a little over, but she's working on that. Vital signs are within normal range. On general inspection of the patient, she's alert and oriented. She was conversant with me. Her skin is even. I don't see any lesions or any traumatic deformities. Breathing is very relaxed. Okay. The scalp, any pain?
No.
Okay. No masses, lesions, or nodules. The scalp moves freely over the scalp. The hair is, the texture is good, it's coarse. There is some thinning on the scalp. The patient has alopecia. We're going to palpate the facial bones for any tenderness. Any tenderness?
No.
Okay, good. We're going to palpate the maxillary sinuses. Any tenderness?
No.
And the frontal sinuses. Okay, good. The patient's eyes and ears are symmetrical. We're going to palpate the temporomandibular joint. Open your mouth for me. Very good. Close. Any pain?
No.
Okay, no crepitus or pain is elicited, and she has excellent control over those muscles there. We're going to now assess some cranial nerves here, so can you clench your teeth for me? Okay, good. Wrinkle your forehead. Close your eyes tightly shut. Great. Okay, stick out your tongue. Smile. And then puff out your cheeks. Okay, wonderful. And if you relax your face and then close your eyes and tell me when you feel this.
Feel.
Very good. The patient is able to feel the light sensation over bilateral forehead, cheeks, and chin. We're going to move to the eye assessment. Upon visual inspection of the eyes are aligned with the face, the eyebrows are symmetrical. The eyelids, I don't see any ptosis, don't see any drooping, don't see any discharge. We're going to now look at the conjunctiva. Okay, conjunctiva is pink and moist without any discharge. The sclera is white. We're going to palpate the lacrimal apparatus. Good. No regurgitation. Any pain?
No.
Good. Going to have the patient close one eye and hold this out and read the smallest line you can read. Hold it out 14 inches for me.
ACLP.
Great. Other eye.
ACLP.
Okay, great. All right, and we use this card. I do not have a Rosenbaum chart. Before the assessment, the patient was checked with the Snellen chart, and it was 20/20 with corrected vision. We're going to check for pupillary response. Follow the light. Direct. Indirect. Very good. Direct. Indirect. Okay, great. The pupils are equally reactive to light. Would you cover your left eye for me? We're going to now check for peripheral vision. Keep your eyes on my nose and tell me when you see the fingers.
Fingers.
Okay, good. Keep your eyes on the nose. The other hand. Okay.
Fingers.
Okay, very good. And then relax. We're going to do the cover-uncover test now. So if you cover them again. One. And then look at my nose. Good. Okay, and cover the other eye. Good. Very good. Okay, great. So with the cover-on test, I didn't see any strabismus. And now we're going to go ahead and check the extraocular eye movements. Try to keep your head as straight as possible and follow the pin. Very good. I didn't see any nystagmus there. So we're going to move to the ears. I'm going to palpate the auricles and the pinna, and then look inside the ears. Any pain there?
No.
Okay, the auricles are the same color as the skin. I didn't see any discharge, any traumatic things going on in the ear. If you'll close one ear for me, I'm going to whisper something and just tell me what I said. Put your finger into the ear for me. Okay.
Apples, oranges, and grapes.
Okay. The other ear.
Fish, tuna fish, and grapes.
Good. All right. And then while we're at the ears, we're going to test for bone and air conduction, and we're also going to do the Weber exam. I'm going to place this on top of your head and tell me if you hear the ringing in both ears or in one better. And then we're going to go and check bone and air conduction. I'm going to put it behind your mouth so it process. Let me know when the sound stops and then when you don't hear it anymore, okay?
Both ears.
Okay, great.
Okay. Okay.
Okay. Going to try the other ear. Okay. So then we're going to move to the nose. General inspection of the nose. The skin is the same color as the face. The nose is in midline. Don't feel any crepitus. Go ahead and close one nostril for me and breathe in. Okay, and close the other nostril. Very good. The nostrils are patent. We're going to do a visual inspection of the inside of the nares. Okay, very good. The nasal mucosa is pink. The turbinates are not blocked. And the nasal septum is midline. I did see some clear discharge, but that is normal. We're going to go ahead and assess the mouth at this time. The mouth is symmetrical with the face. We're going to ask the patient to open your mouth. Say ah. Okay, very good. Soft and hard palate are pink. Keep it open for me if you will. Teeth are in good condition. Put your tongue to the top of the mouth. Okay, we're looking inside the tongue. Turn it to side. Okay, good. And there is no ulcers or lesions or anything in the bottom of the tongue. The patient has approximately 32 teeth. There's no odor or anything. The oral pharynx is in good condition, and the uvula rises to the top of the mouth. We're not going to assess the gag reflex because the patient can swallow. So we're going to safely move to the neck assessment at this time. Upon inspection, the sternocleidoid mastoid is symmetrical on both sides. The trachea is in midline. We're going to have you push your head down to your chest, up to the ceiling, and from side to side while I'm providing resistance to you, okay? Very good. Very good. Okay. And then shrug the shoulders for me. Okay, very good. The patient's neck is smooth. Range of motion is probably a 4 to 5 on the neck. The shoulders are very good. Strength is good there. The trachea is midline. We're going to palpate the carotids one at a time. Very good. Equal and regular. Can you swallow for me? Okay. The thyroid does not appear to be enlarged. I'm going to have the patient sip some water and hold it in the mouth. And I'm going to palpate upon the swallow. Hold it in. Swallow for me. Very good. I don't feel any thyroid enlargement there. At this time, I'm going to assess the nodal areas of the neck, and I'm going to go ahead and do the infraclavicular and axillary nodes while I'm there, okay, Miss Deborah? For your auricular, any pain?
No.
Post-auricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial cervical chain, deep cervical, supraclavicular, infraclavicular, and hold your arms out for me. Don't feel any axillary enlargement, okay? Just relax. And also, I don't see any jugular venous distension in the neck there. So we're going to move to the arms, hands, and shoulders. Hold your arms out for me. Squeeze my hands. Very good. Good strength there. Push out. Push down. Okay, push up. Very good. So the strength is 5 to 5 there. The skin is intact. I don't see any lesions. I don't see any swelling in any of the joints. The temperature is warm. Okay, I'm going to take a look at the nails. Nail beds are smooth. They're pink. Capillary refill is less than 3 seconds bilaterally. While we're here, we're going to assess for pulses. Brachial pulse, even and regular. Radial pulse. The amplitude is regular and it's even. Okay, we're going to go ahead and do the popliteal pulse while we're doing pulses. Okay, very good. Posterior tibial, good. Dorsal pedis. Okay, that's normal. It's regular. Okay, and if you will, please turn to the back facing me. We're just going to assess your back here. Okay. Don't see any lesions or anything on the back. The breathing is still even and unlabored. We're going to check for thoracic expansion. Take a deep breath in and deep breath out. Okay. Thoracic expansion is even, it's symmetrical. Okay. We're going to palpate and percuss for costovertebral angle. Let me know if there's any pain. Okay, I'm going to palpate. Any pain?
No.
Okay, while I'm here, I'm going to assess the back part of the lungs. I'm going to percuss. Percussing the posterior side of the back, the lateral side. Okay, I'm going to auscultate for breath sounds. Take a deep breath in and out. Deep breath in. Okay, deep breath in, out. The lateral. Very good. So now I'm going to percuss for diaphragmatic excursion. Resonance. Here's some dullness. I'm going to stop there. And I'm going to percuss upwards. Okay, so that area is about 4 or 5 centimeters there. Okay. We're going to have the patient tested for tactile fremitus. When I touch your back, just say 99 for me, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. The vibrations are felt equally throughout the thoracic area. Okay, and if you will turn towards me. We're going to do a visual inspection of the chest area. The respirations are still even and unlabored. They're regular. Don't see any pulsations here. I'm going to percuss the front area here of the lungs. Very good. Okay. I'm going to auscultate. On the back side, I didn't hear any adventitious breath sounds, and her lungs were clear. In and out. Lungs are clear. We're going to check the lateral portion. Lungs are clear. Very good. We're going to assess for tactile firmness on the front portion, so the same as the back. Just say 99 when I touch your chest.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, lift your arms up for me.
99, 99.
Very good. And if you will lay back on your back for me. Okay. I'm going to palpate the precordium. I didn't feel any heaves, lifts, or thrills there. Okay. I'm going to auscultate with my bell for any heart sounds, starting with the aortic valve, pulmonic, Irv's point, tricuspid valve, and mitral area. Very good. I didn't hear any murmurs or any extra heart sounds. Okay. While I'm here, I'm going to start with the abdomen. I'm going to auscultate for any abdomen sounds here. Don't see any pulsations in the abdomen. Assessing all 4 quadrants. Valve sounds are present. I'm going to auscultate with my bell for any aortic, for any arteries there. Aortic artery. Right and left renal artery. Right and left iliac artery. Right and left femoral artery. Very good. I'm going to percuss for tone. I hear dullness over here on the right, just possibly the liver. I feel dullness over here in the 9th or 10th rib, possibly the spleen here. I'm going to move to a light palpation. Please let me know if there's any tenderness or pain. Okay, just using one hand for light. I don't see any guarding. Very good. Going to move to a deeper palpation, looking for any masses or organs here. Using both hands this time. Any pain?
No.
Very good. Okay, so at this time I'm going to ask you to hold your breath. I'm going to palpate for the liver. Okay, The edge here is smooth and firm. Okay, relax. And then I'm going to palpate over here. Not able to palpate the spleen, it's non-palpable. I'm going to palpate the right and left kidneys. Okay. I'm going to check for the left apical impulse. It's tender and brief. Okay. Very good. The muscles are okay in the abdomen. Didn't feel any guarding. They're strong and they're soft. If you could sit up for me. Okay. We're going to move to your legs here. If you'll put your legs out for me straight. Push. Okay, good. Push up. Very good. Okay. I'm going to pull this up a little bit. Okay, the temperature is warm on the lower extremities. The patient does have a little edema on the left leg, left ankle, lower extremity here, 1+. The hairs are evenly distributed on the legs and the feet. The muscles are approximately symmetrical, and she has good strength in the lower extremities. At this time, I'm going to assess the patient's reflexes. We're going to start with the brachial. Okay, we did see the thumb. Very good. We're going to assess the knee. Okay. Very good. We're going to assess the Achilles tendon. Wonderful. Very good reaction. Any pain?
No.
Okay. We're going to go back and look at your fingernails. Good. We're going to check for clubbing while we're here. Hold them together. Okay, I don't see any clubbing, and we've already established that the nail beds are smooth. The capillary refill was fine, and we've done the pulses. So now we're going to have the patient stand up. And if you will, please just bend over, and I'm going to check your cervical spine here. Okay, very good. You can stand. And then lay back on the table, your back side. If we suspected the patient was having any lumbar pain, we would have the patient put the legs up in a 90-degree angle. Let me know if you have any pain.
No.
Okay, so no pain at 90 degrees.
No.
Okay, very good. You can sit up. This concludes our examination. Thank you.